Let's have a look at a few ideas to make your day simpler and more organised. We're going to show you the LaminateButler and a VisionButler. Both are made of a medical grade silicone and both are autoclavable. The LaminateButler is basically a soft, pliable palette that you can use for your staining glaze. You can use it for your crown and bridge. You can use it for your implant restorations, organising everything prior to the patient appointment in a just organised manner that helps you know what should be where and helps your nurse or assistant keep everything in order. This is particularly useful if you're doing multiple component work or bridge work with implants, because as you remove the healing caps and are ready to place your bridge work for a try-in or final fit, you can have everything available all in the right place, and if needed you can return the healing caps into the same places that you took them out of. Now here I'm going to show you how we use the LaminateButler a little bit more productively with the staining glaze. It has a lid which can be removed using the little thumb plate which you see at the side. The lid is not actually a photo inhibitor, although it's tinted yellow. This is really a dust protector and to stop your staining glaze from evaporating or drying out. I'm a relatively new user to the Mayo concept, but all of these staining glaze techniques I use a concept where what we do is we number each of the glazes and the glaze can be put into the appropriate well in the LaminateButler, so when you need to top up that well you know which pot is required to top up the correct colour. Don't forget to always mix your colours to the chosen consistency using your agate spatula. This keeps the staining glaze clean and pure. And don't forget, if you're doing the staining glaze on a patient but not in the mouth of the patient, which I'm going to show you this technique later, but always take your photograph and your shade tabs, making sure that you include the actual number of the shading, but take these images before you start your preparation, because those teeth will dry out during the preparation, altering the shade that you are going to compare when you're doing your staining glaze in a laboratory. Here you can see I'm using an iPad. These are great for color control, nice and easy to use. It's a good big picture that you can zoom in on and zoom out of. Here we have a damp tissue which we change for every case so that you can clean your brushes between each of the stains, and the use of a fine tip brush really I can't highly recommend enough. So having your desktop clean, organised and simple really just makes your day work so much better. So next I'm going to show you, this is a patient where we're fitting a VisionButler. This is a new soft silicone lip and cheek retractor. There's a little bit of a trick to getting it in, and you have to settle it into the patient's mouth. Open a little bit please. Just open and then closed. You can see now that's settled in there nicely, and the cheek retention will hold it in place. Here we've used a dry and paste to hold the bridge in place. These are orthodontic bracket tweezers, and I'm just going to demonstrate how we use these to remove a bridge in the mouth with control and reliability So if we're going to do a staining glaze in the mouth with adequate tissue control using the VisionButler, we are able to take this bridge off. You'll notice I haven't pushed it home fully. It does need to be fully seated and engaged gingival tissues. It just needs to be in place. This gives you the added advantage of ambient light and comparison of characterization of the teeth next door. We're going to have a look at a better case visually in a minute. This is really just to show you how to remove the bridge once you have achieved your chosen staining glaze. Use your finger behind just to control, and there we go. You can just nicely lift off the bridge, and that can go in the furnace ready for cementation once it's cooled down. We can leave the VisionButler on all the way through your bonding process for ease and control. Again, especially useful if you're doing multiple restorations. And there you can see we've used a floss to hold the bridge, which also allows me to clean up any residual cement between the teeth. So this is a great idea if you're able to achieve good moisture control. You can actually stain your bridges in situ prior to cementation. So I had a bit of fun here doing a staining glaze, and you can see we're using a combination of a probe, or some people use a file for fine detail, but work at the cervical area first. Apply your glaze as a nice thin paste, and then build up the cervical regions with the darker colours. Minimal incised ledge. As you can see, that's just nicely applied using a perio probe, and this we will then just merge using a fine tip probe or a brush. A little bit of orange on the incised ledges can work very well, and my favourite of all is when you come to do the interproximal areas and build up the highlights using white tips, which you can place, then blend, moving these with either a little brush or again with a fine tip to try and see if you can mimic some more natural, lifelike colours of the tooth. This would not be possible if you couldn't control the soft tissues. The other bonus with the VisionButler is it's reusable, as tested to over 1,000 times, which would be equivalent to about 12 cartons or 80 units of Optrogate, saving you both clinical waste, wrapping, packing, storage and postage. This is a very efficient, effective and comfortable technique. So all of these products, the VisionButler and the LaminateButler, are available from Sterilu, and we can supply these worldwide, or in some countries we have dealers. Just contact us on sterilu.com and we'll advise you on how best to help. I hope that was interesting. Thank you.